All right. Well, it's good to see everyone, even the little black tiles. There's a whole bunch of you on here, so welcome. I'll give a little brief introduction and then we'll get into the presentation. So I am a physical therapist for KORT, and I specialize in our pelvic floor physical therapy treatment. I have been doing that for about 2.5, 3 years now, and have done several presentations like this. You all might have seen me there pre-COVID. I think we did 2 back in 2019, if I remember correctly. So some of this might be a little bit familiar, but I tried to kind of update it and add in some different things just so that we can have a slightly different take on it today. So with that, I'm going to go ahead and share my screen and we will get started. Okay. All right. Can you all see that okay? All right. Perfect. So we will get rolling. So what is the optimum number of voids within 24 hours? This is a big range. There's a lot of variety in this number. It changes with age. It changes with habits, if you're drinking more, all of that kind of thing. But a typical number is between 5 and 7 times. Okay. And then the next one is voiding at night normal. This is, again, a big range. It kind of can depend on a lot of things, but the answer to that is yes. So if you go to the bathroom 1 to 2 times throughout the night, that is considered to be normal. It kind of, again, medication can have a play in that, how much you've drank during the day, how much you have voided during the day, etc. But it is normal to go at night as well. So we're going to go over some anatomy. That this is the general core anatomy. It's the general pelvic floor anatomy, just to give you all an idea of how important all of these muscles are and how they all kind of function together. So you have the main aspects of your core. Everybody automatically thinks of abdominal muscles whenever you talk about the core. And that's true, those are involved, but they're just one of the 4. So if you think about an actual core, there's a top and bottom, and then kind of front and back too. So the transverse abdominis, that is your deepest layer of abdominal muscles, that kind of acts like a corset. You can see how in that picture, sort of, the fibers kind of go across. So as that muscle contracts, it kind of acts like a corset and draws your abdomen in. That muscle is super important in your whole core function. You also have your multifidi, which are in your back. Those are kind of hard to see. Those are just those little red muscles going along your spinous process in your back. They engage whenever your core is turning on. And then as far as the top and bottom, you have your diaphragm on the top, and then the muscles of your pelvic floor are on the bottom. So this whole unit functions really closely together. And that's how whenever you contract your abdominal muscles, your pelvic floor muscles are kind of working already, and vice versa. Whenever you're just breathing, you're getting some activation of your pelvic floor muscles. So all of these muscles are important. And if we have any kind of weak link in the system, so say your abdominal muscles are pretty weak, say your pelvic floor muscles are the weaker ones, if you have any kind of weak functioning muscle in that system, then it can cause issues. Okay. Then, so the main functions of the pelvic floor specifically, because that's what we're all here to talk about. So that muscle in particular, when it is contracting and it's engaged, it maintains tension through the whole base of your pelvis. And that's important for keeping you continent. And supporting your pelvic organs. Those are the main 2 aspects of its function that we rely on the most. And then they also need to relax, because when you go to sit down on the toilet to avoid urine or stool, you need those muscles to relax all the way to let everything out. Okay. So let me see if I've got another picture here that I want to go over. And before I do that, I'm going to show you kind of on this model, and I can't really see there we go. Okay. So can you all see this model? Okay. Okay. So this is 3D model of your pelvis. So imagine you're sitting right here. Okay. Then I'm going to flip it up just so you can see the bottom muscles. So these muscles are your pelvic floor muscles. Okay. So you can see it kind of looks like a bowl right through here. It goes from one sit bone to the other sit bone to your tailbone in the back, all the way to your pubic bone in the front. Okay. And these muscles, people describe them as a hammock. So you can kind of see in this view, like they hang down a little bit. They're kind of a hammock all the way through there. And when those muscles engage, they pull up and in this way, okay, through your pelvis. So they contract and tighten and go into your pelvis, okay? So that's just to give you a little bit better orientation of those muscles, because these 2D pictures are not quite as helpful. And in this, cross section, you can just see the little line of those pelvic floor muscles, but they're really broad. Like they're the whole base of what you sit on, essentially. So it's a really big muscle group, okay? So in this picture though, this kind of depicts how your diaphragm and your pelvic floor work together. All right, so this is something that's really important and something that is often missed whenever we're telling, if a doctor, you just had a baby and a doctor says to do your Kegels, okay, but that's all they give you. They don't really tell you anything else. Or your urologist says, okay, well, you've got incontinence, you just need to do Kegels, but they don't really give you any other information along those lines. This is something that's really important for you to know. Your diaphragm and your pelvic floor, for them to be working optimally, need to work in reverse of each other. So as one's going up, the other's like they're both kind of contracting together, and then they both relax together. So they act like a piston in your car. So they're kind of going up and down together like this. So when you inhale, your diaphragm actually lowers, which is kind of a backwards thought. But when you inhale, your diaphragm contracts and actually lowers down in your body. And when that happens, your pelvic floor can relax and lower down a little bit. When you breathe out, your diaphragm raises up, and then your pelvic floor can contract and raise up. Okay, so that doing Kegels, and we're going to go over this a little bit later, but doing Kegels just by themselves can be helpful to an extent. If you do them coordinated with breathing, that's like the number one take home from all of this. That's the most important thing I can teach you, because you'll get the most out of it at that point. Okay. And then that also, because you're doing it with breathing, you're getting abdominal movement. You're getting those core muscles turning on and everything kind of working together a little bit better. Okay. Like I said, we're going to kind of talk about how to do a Kegel again, but I just kind of wanted to give you all this orientation with the other anatomy and how your abdominal muscles and low back muscles even are important in all of it. Okay, so now I want to talk about a couple different diagnoses and issues that can happen with your pelvic floor. I'm going to go over two, and they're the two most common that I see. We treat way beyond this, but like I said, these are the two most common. And so I figured we would at least start here. And then if you all have any specific questions, we'll have time for that at the end, and I can hopefully answer them for you. Okay. So any kind of weakness in that pelvic floor can contribute to urinary incontinence. So there are three different kinds of urinary incontinence. You have stress incontinence, urge incontinence, and mixed incontinence. Stress is like you sneeze, you cough, you laugh, something along those lines. You just have an increase in abdominal pressure for some reason. Lifting is another good one. You might, if you roll in bed and if you hold your breath whenever you roll, that puts a lot of pressure on your bladder. Different activities like that, where you are physically putting an increase in that abdominal pressure on your bladder, and it's causing you to leak because your muscles on the other end of that bladder are not strong enough to kink the hose. Okay, so that's stress incontinence. Urge incontinence is when you get the signal to go, and if you don't get to the bathroom like immediately, then you're going to have leakage. So that's more urge incontinence. These two can go together a lot of times, which is where they come up with mixed incontinence. So that's where you've kind of got aspects of both. And the mixed, truthfully, the mixed is probably the most common, because anytime your pelvic floor muscles are weak, you can have that stress incontinence, but you also are not able to hold it back. So when you do get the urge, instead of your body giving you like it should be maybe a 2 or 3 out of 10, like just a little yellow light, like, hey, you might need to think about going to the bathroom in the future. It's not an emergency, but just, if you see one, go. That kind of a message. Your body goes from that to giving you a 10 out of 10 red alarm really quickly if you don't have the strength to hold your urine back. Your body knows, like, okay, well, we can't let this bladder get too full, or she's gonna, have a complete accident, and we can't let that happen. So it gives you that really, really high alert alarm a lot sooner if those muscles are weak. Okay, so that's how that whole system kind of works. And like I said, a lot of the times, because both of these are just simply caused from pelvic floor muscle weakness, they often go together. So mixed incontinence is probably the most common diagnosis of the two, or of the three, I suppose. Okay, so this is a good kind of depiction of what we just talked about. So you're on the left of the screen there. That is your bladder filling with urine. Those two little things along the bottom of your urethra, those are supposed to depict your muscles. Okay, if those muscles are really weak, they're not tight, they're not firm, all that kind of stuff, you're going to have this kind of like lowering. Your urethra is not going to remain closed like it should. So you can kind of see that in the picture. There's not complete closure at the bottom of that little cartoon figure. Okay, and then you're going to have leakage. On the right hand side, if you can tell the difference between those muscles, those are much thicker. When they're contracted, they're completely closing that urethral opening. And then your bladder is, it's happy. Even though it's got urine in there, you're not going to leak. You're not going to have any issues. It can hold it until you make it to the bathroom, because those muscles are much stronger and much more supportive. The other thing I want to mention too, when your muscles are really strong and they're closer to the one on the right, when your urethra, the walls of your urethra, whenever they actually touch, that shuts off the urge to go to the bathroom. So it literally is kinking the hose. And when your body can do that, it'll almost shut off the urge. And you can kind of forget about it for an hour or so. And then whenever you get the urge to go again, then you might need to go at that time. It might be a little more urgent. But if you kink the hose, there's a neurological process that's going on that if the walls of your urethra are touching, it shuts off the urge to go. Okay. So this is kind of what we've been talking about, but strengthening those pelvic floor muscles will kink the hose. So it reduces leakage with those quote unquote stress activities. Sneezing and coughing are the most common. And it will reduce the urgency so that you can make it in time. And there are a ton of different factors that go into this. This is just simply talking about muscle function, but say if you're on if you have diabetes or something and your body is just producing more urine for that reason, that affects it. If you have had some coffee that morning, or if you've drank something with caffeine in it, that actually affects the acidity of your urine. And so your body wants to evacuate that even faster. And it's diuretic. So it's kind of encouraging that system to work a little faster than it may normally work. And so whenever that's happening, your body's going to want to evacuate and get rid of that urine a little bit faster. So that can kind of contribute to some of those urgency issues as well. Medications can affect urgency. You know, if you're on like HCTZ, that's a diuretic that's going to kind of increase that, the speed of that urine processing. You're going to have to go more often, etc. So there are a ton of other factors involved, but just simply talking in muscle terms, strengthening those muscles through that pelvic floor will help with these urge symptoms and the incontinence symptoms. Okay. Then, so this is the other kind of major thing that goes on, and I see women for this issue for prolapse specifically at all ages. I mean, from pregnancy related prolapse all the way up through, you know, in the later stages of life where gravity has been working on those organs for a long time and you're getting some prolapse for that reason. So this is an issue that happens, and the incontinence is too. It's an issue that happens in all ages. So this prolapse, when your pelvic floor is weak, it's not supporting the organs like it should. So you can kind of see in that bottom picture, that series of picture, you can have actually 3 different kinds of prolapse. So the muscles would be kind of right across the bottom of all 3 of those different organs there. So it runs across your urethra, runs across the vaginal opening, and then runs across rectal opening too. So it's close to the bottom of that like sling there would be where those muscles are located. So on the far left, that's normal. That's where everything should be. And then once you get to the cystocele, that's a bladder prolapse. So your bladder is kind of falling backwards into that vaginal space, and it's kind of falling out through not necessarily falling out, it can, but falling kind of down into that vaginal opening. Okay. Then you can also have uterine prolapse or cervical prolapse, even if you've had if you had a partial hysterectomy, but you still have your cervix can kind of be falling down as well. And so that your uterus then is kind of falling into like straight down into that vaginal canal. And then the rectocele, that's more if rectum is kind of falling forward into that vaginal canal. Okay, so you can it's pretty common to have a combination of 2 or 3. If those muscles aren't supporting everything like they should, you might get everything might kind of be collapsing into that vaginal space. The challenge with pelvic organ prolapse at the top, and what's not pictured through here, at the top of all of those organs, you have ligaments kind of extending up into your abdominal cavity, on the sacrum, like on the back side, into your pubic bone on the front side. There's a whole web of connective tissue in there that should hold everything up. So you should have muscle support from the bottom. You should have ligamentous support from the top. And constant pressure on those ligaments where you're kind of just, gravity does this, but even if you have improper, when you lift something, you hold your breath. That's not a super healthy way to lift something. And so if you're doing things along those lines, you're kind of putting pressure on those organs. So the ligaments can get lax and you can lose support from the top side. If that happens and you have weakness on the bottom side, there's essentially nothing holding those organs in place like it should be. So that's when these issues can get really severe. So posture is another thing that plays a really important role in this muscle function. So remember, think back to when we were talking about all of that anatomy, how you've got your abdominal muscles in the front, your low back muscles, diaphragm, all of that in conjunction with your pelvic floor. If you sit really slumped over and you try and take a big deep breath, you're not going to get very much air, right? If you sit up nice and tall so to where your ribs can expand and you try and take a big deep breath, you're going to get a lot more air through those lungs. It's going to function a whole lot better. Same thing happens at pelvic floor. If you're sitting, if you have bad posture, sitting or standing, and you're trying to do Kegels or something in that like slumped posture, then you're not going to get optimal muscle function, and you're not going to get that full engagement of that muscle. Okay, so the posture that you're in can play a big role in, one, how severe your prolapse can get, and then two, how much you can treat it. So it is important to kind of think about and make sure that we're always sitting with good posture. What our moms told us when we were kids is applicable for literally our whole lives. Okay, so that's just something to kind of keep in mind. So there are things that you can do. So that top picture, it's kind of got goofy coloring, but I liked it because it actually showed the pelvic floor muscles. So you can kind of see the two gray areas on that picture, just the circle in the front, and then you can tell that's your kind of sacrum and tailbone in the back. That pink thing in between the two, that's your pelvic floor muscle. So when it contracts and it's lifting up, it's pushing all those organs back up where it's supposed to be. So you're keeping everything in place much, much better whenever the muscles, those pelvic floor muscles, are working the way they're supposed to, okay? And it's lifting everything up into that pelvic cavity. And then that bottom picture, we're gonna kind of go over that, but that is one of my favorite exercises. I have patients do this very frequently, depending on why they're coming to see me. We're gonna talk about it today because it's a really good way to suppress an urge, okay, to kind of get you to the bathroom in time. So let's talk about those next. So the number one, how to do a pelvic floor contraction or a Kegel is kind of layman's terms. Kegel is named after a man actually who discovered the ability of this muscle to contract. His last name was Kegel, and he patented it so that now we call the contraction his name, which I think is funny. So I often just say pelvic floor contraction, so I kind of use those interchangeably. But what I always have patients do is start laying down. You could be kind of reclined backwards. So if laying totally flat is uncomfortable or hard to breathe, you can be reclined. But just so that your hips and pelvis are pretty much flat, that way your muscle is not contracting against gravity. So if this is the pelvis, if you're laying flat like this and your muscles are here, when you contract, they're going to kind of go up this way. So the weight of your organs and all that kind of stuff doesn't have any effect on that muscle. So it's a little bit easier to feel that you're doing the contraction in that position. So that's a good place to start. And when you do the contraction, I always have everybody inhale first and then exhale and contract your pelvic floor. Through that inhale, exhale, there should never be a moment of holding your breath. You should always, it's breathe in, slowly breathe out. Just no pause in the middle. You kind of do that fluidly. And when you start your exhale, that's when you start your pelvic floor contraction. And it's the way this muscle functions. It is not a fast, like whole muscle contracts really, really forcefully. It's going to feel just kind of light. You're just kind of working that muscle engagement. And then by the time you have finished exhaling is when that muscle should be contracted at its strongest. And then you inhale, you let everything relax. And then you exhale and contract it all up again. So you have to do it slowly. One, so that you don't hyperventilate because you don't want to breathe in and out super fast a whole bunch of repetitions in a row. But 2, you got to give that muscle enough time to contract all the way and enough time to relax all the way. Okay, so it should feel like a lift. Some women feel it more vaginally, so you might feel a vaginal kind of squeeze and lift up. You might also feel it more rectally. So if you could feel it more around your anus, kind of puckering up and in too. All of those muscles are connected, and they all function with the same neurological structure. So there's not a way for you to contract one versus the other or left side versus right side. They all contract together. Okay, so that lift of everything kind of coming up and in is a sensation that you should get whenever you're doing the contraction correctly. This last little bullet point that says you may also feel tightening across your lower abdomen. That's important because those are the abdominal muscles that we were talking about earlier. So that's your transverse abdominis muscle. And so when it contracts, it kind of pulls in. So you're going to have the lift on the bottom side of pelvic floor. You're going to have the pulling in of those abdominal muscles across your abdomen as well. Okay, so some people feel it, you can really feel it a number of different places, but as long as you're feeling it at even a little bit at each of these, then you are doing it correctly. All right, and like I said, laying down is the easiest way to start, but you can progress it from there. So if you've done it laying down and you're feeling pretty good and you're like, I've got this, I'm doing this correctly, and you want to do it seated because you are driving to see a family member or something, and you can do it in the car pretty easily, and you can do it seated as well. There's really not a position that's quote unquote off limits as long as you're doing it correctly. All right, so this next one, this is an urge suppression technique that I like to teach some of my patients. So this can also just be an exercise, but again, this is not, if you came to see a pelvic floor therapist and we would do a full evaluation and check out your muscle strength from abdominal muscles all the way through your hip muscles, all the way into your glute muscles, etc. Then we would do that and determine exactly what other exercises were appropriate for you. This is a common one that we like to use, but it can also be used to help suppress the urge to go to the bathroom. So say you are seated, you're on your couch watching TV, and you get the urge to go to the bathroom, and you have the problem that you might not make it in time. This is a good thing to do before you get up to go to the bathroom. So you can squeeze, we use a ball in the clinic. You can just squeeze your knees together without having anything in between them. But you squeeze your knees together and you do that pelvic floor contraction with the breathing, and you try and hold that squeeze for about 3 to 5 seconds. That is something that will help engage your pelvic floor muscles. Just the contraction, obviously you're focusing on the pelvic floor muscles, but when you do the knee squeeze, you're also engaging your inner thigh muscles or adductor muscles. And whenever those contract, there's a whole bunch of research that says that you get a better pelvic floor, a stronger pelvic floor contraction when you're using these other muscles in conjunction with your pelvic floor. And the reason is where they attach. Your muscles, your adductor muscles attach to your pubic bone, like right through here. Okay, and so when you're contracting here, it carries over into that pelvic floor really easily. And so you get almost a better, like a stronger bang for your buck kind of thing. You're getting a little bit more reinforcements from those other muscles in the periphery of your pelvic floor. So this is something that whenever I do have people do it for an exercise, we just do this repeatedly. We do this for a count of, 10, 20, 30, something along those lines, whatever I feel is appropriate. And then we kind of use that as a way to train that brain and train those muscles to engage and buy you some time to get to the bathroom. Because I know if any of you have ever tried to hold it in and do little kids do the potty dance where you have your legs together and you're kind of waddling to the bathroom because you're trying to hold it in. That is using those muscles. Your body has figured out just naturally that you need to squeeze those inner thighs together to reinforce those pelvic floor muscles. So if we're just training these muscles on their own, whenever we do need them to work, they'll be even stronger than if you've not ever done these exercises. Okay. Then one more. So this is kind of along those same lines to buy you a little bit of time to get to the bathroom. You want to inhale, then you want to exhale and contract your pelvic floor, then stand up. So if you stand up and you're on your way to the bathroom before doing a contraction, then it is very hard to get your pelvic floor muscles to contract on your way to the bathroom because you're walking, you're kind of rushing, you're opening the door, you're trying to undo your pants, whatever else your other muscles you're using. It's really hard for your brain to devote that much attention to your pelvic floor to get it to contract. So if you can do something like this with a sit to stand, then you're going to kind of have prepped those muscles a little bit. You'll have those muscles already engaged. You'll be able to contract and hold your pelvic floor a little bit easier if you've already done that before you even get up. So same kind of idea. You can do the squeeze if that works better for you. You can try this too if this is a little bit more successful. So you can contract or inhale, you exhale and contract pelvic floor, then stand and then walk to the bathroom. And that might buy you a little bit more time to make it. Okay. So that's another kind of activity that you can try. And again, this is something that I will often have people do just as an exercise, just to practice it, because you need those muscles to get better at doing these activities on a regular basis so that when you need them, they'll work for you. All right. So now those are the main things that I wanted to go over. And I wanted to give you all an idea just how many of us do this type of treatment. So we are all over the place. I am in Bryan Station, and I didn't put my own name on here. I'm sorry. But these are the other therapists that can also treat pelvic floor dysfunction. So Tori Justice is at our Eagle Creek location. Amy Thurman is in Richmond. Jordan Redmond is in Brandon Crossing. Kristen Franklin is in Beaumont. And then Katie Stevenson is in Versailles, and Tara Buckles is in Nicholasville. And they have all had this training just like I have. So any of these lovely ladies would be happy to help, just, depending on what's easier and closer for you to get to. There might be some locations that work a little bit better closer to where you live. So all of these women can help you with any of these issues that we've been talking about today. All right. So I think I am ready for questions. Let me go ahead and I'm going to stop sharing my screen so I can see all your lovely faces again. All right.
And I'm going to jump in real quick. I'm going to actually stop recording at this time so that you can feel comfortable asking questions and those questions not be out on YouTube.
Perfect.
So we just thought that might make everyone more comfortable to, ask their own questions. So remember, when you need to unmute yourself and ask a question, and then you'll need to put your mute back on. But I'm going to go ahead and stop that recording. And I just want to say thank you to Katelyn and to Teresa for making this possible. We certainly appreciate everything you do. So I will stop the recording.